Welcome back. News First at noon. It's a major problem for people in Kentucky, but did you know that your pet can also get diabetes?
Dr. Butch Schroyer is here to tell us all about it, and the answer is no, I didn't know this.
Yes.
How are you doing?
Well, I'm doing great. Unfortunately, we have pets that have problems like people do. You know, we have almost 30 million people have diabetes around the country, and it's a growing problem, particularly for our cat population. I've got a dog in the clinic right now today. We're doing some study on glucose curves because it's diabetic. But the problem we run into with our cats, I think many times, is they don't get seen by their veterinarians as often as we'd like to. Cats are indoors, they don't get exposed, people think things can't go wrong. But still metabolically things happen, and diabetes is one of those things. We fight obesity in the cat just like we fight obesity and weight problems in people. And it's one of the biggest key factors that cause problems for us. So our feline patients, they live like Garfield. They said that all they do is get up and eat and go to the litter box and come back and lay down and nap and then go eat and go to the litter box again. So that lack of activity predisposes them to weight gains, and that increases their risk of diabetes.
Well, what do you do about that?
Well,
Yes,
interestingly enough, they respond to insulin just like you and I do. And sometimes if we catch it early enough, we can alter their diet and we put them on a high protein, low carb diet. It's kind of like an Atkins diet for cats. And that protein helps stabilize calorie absorption, helps them drop weight safely, and many times we can get away without having to do insulin injections.
Should this just be part of a normal checkup, normal routine?
At our clinic, at least once a year, we try to do at least some little minor blood screening to see what's going on. And of course, the first marker we have is an elevated glucose or an elevated blood sugar. You hear people, oh, I got sugar. Well, that's what they're talking about. They have excessive glucose in their bloodstream, and that diagnoses diabetes for us.
but you saw our forecast, close to 100 degrees, if not there or more, over the next few days.
Really scary. You know, we just had the issue down in London where a child was left in the car for 2 hours. And it's one of those things, we go out, we take our pets with us or our child, and it's out of a routine. They're sleeping, the dog may be laying in the back seat. You get out of the car and you're not aware. So you got to be aware when you have those young ones with us. The other thing is the car temperatures rise very, very quickly. In a half hour, you can have a car temperature go over 140 degrees and heat stroke sets in. So you have to be very cautious. Shade, windows totally down, so animals have to be locked in the car and be taken care of. So be careful. And best thing is leave them home.
Yeah. Thank you.
Good reminder. Thank you.
Animalcareclinic.net for more information from Dr. Butch.